Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today we will be discussing fall immunizations. Everyone has entered the meeting on mute, but we will have a discussion following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's webinar topic is identifying changing conditions, and that webinar will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guest today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, thank you for joining us again.
Thank you, Kathy, and thank you all for joining us this afternoon. As Kathy mentioned, my name is Jennifer Brown, and today we will talk about gearing up for fall immunizations. Next slide. So we'll talk about the fall immunizations. As we move into the fall months, as things get cooler, we are, faced with an increased rate of respiratory diseases. So one of the things that's really important during this time is to stay up to date in those fall immunizations. So in summary, staying up to date with immunizations is essential for personal health and well-being, community well-being, and global public health security. It's a simple yet powerful way to prevent diseases, save lives, and build healthier and more resilient societies. The first reason why it's really important to stay up to date is disease prevention. Immunizations protect individuals from potentially serious and life-threatening diseases. They are one of the most effective ways to prevent infections and their associated complications. The next reason is community immunity, or as sometimes called herd immunity. When a significant portion of a community is immunized, it creates a protective shield that limits the spread of diseases. This benefits not only those who are vaccinated, but also vulnerable individuals who may be unable to receive vaccines due to medical reasons. Also prevents outbreaks. Immunization programs help prevent outbreaks of vaccine preventable diseases. By maintaining high vaccination rates, communities can reduce the risk of epidemics. Certain individuals, such as infants or elderly individuals, and those who are immune compromised, are more susceptible to severe illness. So staying up to date with immunizations helps protect these vulnerable populations. And also, high vaccination rates lessen the burden on healthcare systems, reducing hospitalizations and healthcare costs. This, in turn, enhances the capacity of healthcare providers to respond to other health crises. Next slide. So today we're going to focus on 4 immunizations such as COVID-19, influenza, pneumococcal, and RSV. Next slide. We'll talk first about COVID-19 vaccinations. So COVID-19 vaccines represent a groundbreaking development in the field of immunization. COVID-19 vaccines are safe and meet the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality. COVID-19 vaccines are effective in preventing severe illness from COVID-19 and limiting the spread of the virus that causes it. It also reduces your chance of developing long COVID, which can develop after an acute infection and last for an extended period of time. As COVID cases and hospitalizations are on the rise in the US and several new variants spread, it is extremely important to encourage residents and staff to stay up to date with their COVID vaccinations. On September 11th of this year, just this past Monday, the FDA approved an updated COVID-19 vaccine. These updated vaccines developed by Pfizer and Moderna are projected to be available later this week. And COVID-19 vaccine recommendations have been updated as of September 12th on the CDC website. The CDC is now recommending the updated COVID-19 vaccine for the fall and winter virus season. The updated vaccine should work well against currently circulating variants of COVID-19, including the BA.2.86, and continue to be the best way to protect yourself against severe disease. Overall, the benefits of COVID-19 vaccination continue to outweigh any potential risks. Serious reactions after COVID-19 vaccinations are rare. Next slide. The current recommendations for people who may get the additional COVID-19 vaccine, updated vaccine, residents age 65 and older may get one additional dose of COVID-19 vaccine 4 or more months after the first updated COVID-19 vaccine. People who are moderately or severely immunocompromised can get one additional dose of updated COVID-19 vaccine 2 or more months after the last updated COVID-19 vaccine. And, they should talk with their health care provider about any additional updated doses. Next slide. The next vaccine we'll talk about is the influenza vaccine. Influenza vaccines, commonly known as flu shots, protect against the 4 strains of influenza virus that are expected to be most prevalent in the upcoming season. For people age 65 or older, the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practice has recommended the use of 3 flu vaccines for people age 65 and above. The recommended vaccines are the Fluzone high dose quadrivalent, flu block quadrivalent, recombinant flu vaccine, and the Fluad quadrivalent adjuvanted flu vaccine. The advisory committee voted unanimously this past June to make this recommendation. However, there's no preferential recommendation for people younger than 65 years of age. And when promoting the influenza vaccination, healthcare providers have a unique role in preventing the spread of the flu. Oh, back one. One is the vaccination advocacy and promotion. So healthcare providers are often the most trusted source of medical information for residents. They can advocate for and promote annual flu vaccination among their residents. Recommending and receiving the flu vaccine themselves serves as a powerful example for residents and other colleagues. Also, vaccine administration. Healthcare professionals are responsible for administering flu vaccines to residents. This includes identifying eligible individuals, ensuring proper vaccine storage and handling, and administering vaccines safely and effectively. Also for infection control measures. Healthcare facilities have strict infection control protocols in place to prevent the spread of flu and other infectious diseases. So, having healthcare providers demonstrating proper protocols can be a powerful statement to residents and other staff members as well. Healthcare providers are often the first point of contact for residents with flu-like symptoms, and they play a crucial role in early detection, diagnosis, and appropriate treatment of flu cases. This timely diagnosis allows for proper isolation and treatment, reducing the risk of further transmission. And finally, because the healthcare professionals are at the forefront and the front lines of influenza prevention, their unique roles encompass several different aspects, such as vaccination promotion, early detection, proper treatment, infection control measures, and participation in surveillance efforts. By actively engaging in these roles, healthcare professionals continue to contribute significantly to reduce the spread and impact of flu in healthcare settings. Next slide. Some strategies for promoting flu vaccination among healthcare workers and residents are education and training, providing education about benefits of flu vaccination, including protecting residents, reducing absenteeism among staff, and preventing severe illness. Some other strategies to help promote is making vaccination as convenient as possible by offering on-site vaccination clinics at healthcare facilities, providing flexible hours to accommodate various shifts and work schedules, and also, making the vaccine free or subsidized so that it removes any financial barriers. Another strategy is to ensure that healthcare leadership is visibly supportive of flu vaccination. Leadership should be role models by getting vaccinated and actively promoting vaccination amongst their staff. Peer influence is also a good promotion strategy. When healthcare workers see other peers and colleagues that they trust accepting the vaccine, more receptive to get vaccinated themselves. Next slide. The next immunization we'll talk about is pneumococcal vaccination. And what I have here is the recommendations for adults age 65 and older. This is the current vaccine schedule from the CDC website. And if a resident has never had a prior vaccine, there are two options. One is to get the PCV20, and the other option is to get the PCV15, and after 1 year, a dose of the PPSV23. And then there are scenarios for people who have had pneumococcal vaccination in the past. So if they have had the PPSV23 only, they are eligible for a PCV20 after 1 year or a PCV15 after 1 year. If they have received the PCV13 only at any age, they are eligible for the PCV20 after 1 year or the PPSV23 after 1 year. And then if they have received the PCV13 at any age, and then the PSV23 before they turned 65, they're eligible for a dose of the PCV20 after 5 years from the dose. And then another option is the PPSV23 after 5 years. Next slide. So some strategies for integrating pneumococcal vaccination into routine clinical practice is to ensure that eligible individuals receive this important immunization. Some strategies to incorporate this into your workflow is to consider implementing standing orders, protocols that authorize nurses or pharmacists to administer vaccines without requiring a specific physician order for eligible residents. This can streamline vaccination process. Utilizing electronic health records or other tracking systems to set up an automated alert to remind healthcare providers to assess the resident's vaccination status and offer pneumococcal vaccines when indicated. These alerts can be triggered based on age or specific risk factors. Developing or using risk assessment and screening tools that help frontline staff identify residents who are eligible. These tools, there's several different tools out there, and they can incorporate age, medical history, and other risk factors. Education for residents to inform them about the importance of pneumococcal vaccination, providing educational materials, discussing vaccination during any consultations, and addressing any concerns or questions at that time. Next slide. The next immunization we're going to talk about is newer vaccination for our population, the RSV vaccination. The RSV is a common respiratory virus that usually causes mild cold-like symptoms such as runny nose, cough, sneezing, and is usually, for most people, they recover from RSV within a couple weeks. However, certain demographics, which include the older adults, are more likely to develop severe infections that can result in shortness of breath, low oxygen levels, and even hospitalization. In addition, RSV can sometimes worsen other medical conditions such as asthma, COPD, and congestive heart failure. Older adults with chronic medical conditions like heart and lung disease, weakened immune systems, or have reside in nursing homes or long-term care facilities are at high risk of serious illness and complications of RSV. The CDC recommends a single dose of RSV vaccine for adults aged 60 and older after consultation with their healthcare provider. The vaccine can be administered alongside other vaccines. RSV vaccines are currently available through vaccine clinics, pharmacy partners, and retail pharmacies. Next slide. So one of the main issues that we see, during the fall time, trying to get everyone up to date, is vaccine hesitancy. Addressing, vaccine hesitancy among residents and colleagues requires effective communication strategies that are based on empathy, understanding, and science. So here's some strategies to engage in meaningful conversation about vaccine. Begin by actively listening to concerns and questions without interrupting. Allow residents or staff to express their fears and doubts about the vaccines fully. Showing empathy and respect for their perspectives and their feelings, acknowledging that concerns are valid, even if you ultimately disagree, offering clear, concise, and evidence-based information about vaccines, using simple language and avoiding medical jargon, and address common myths and misconceptions. You can use visual aids such as charts, infographics, or videos to help simplify complex information, sharing your personal experiences, related to vaccines. Sometimes real life anecdotes can be relatable and persuasive. Answering questions, encouraging your residents to ask questions and provide a thorough, honest, and transparent answer. And highlighting the benefits of vaccination, not only for the individual, but also for the broader community. Explaining how vaccines protect vulnerable populations. And finally, discussing risks and perspectives. So while addressing vaccine risks, present them in a context of overall safety and effectiveness of vaccines, and compare the risks of vaccination to the risks of not being vaccinated. Next slide. Okay, so some approaches to counter vaccine myths. Addressing common vaccine myths is essential to promoting vaccination and reducing vaccine hesitancy. You can start by providing accurate information, information that is clear and evidence-based about vaccines, using simple language, avoiding that medical jargon, and explaining the science behind vaccines in a way that is easy to understand. Don't shy away from addressing specific vaccine-related myths head on. For example, if someone believes that vaccines cause autism, explain the research that has just debunked this claim and share the scientific studies that support it. Using trusted resources can be very helpful to encourage individuals when getting vaccinated. Using reputable sources such as the CDC, World Health Organization, medical associations, and other healthcare professionals may highlight the importance of relying on that evidence-based information instead of, word of mouth myths. Also, being culturally sensitive in your approach to be debunking myths can be very helpful, and tailoring your messaging to resonate with diverse populations. And last but not least is to listen and emphasize. Listen to the individual's concerns and fears without judgment, and emphasize that their worries, and show that you understand their perspective before providing information. Next slide. Another thing to consider when you're moving into your immunization clinics and things like that is vaccine administration and safety. Vaccine administration and safety is a critical aspect of running an effective immunization program, ensuring that you have the proper storage and handling to maintain the correct temperature, and that it's stored away from other medications, and monitoring the expiration dates. Ensure that your staff is qualified to administer the vaccines. They should have competencies, and just make sure they're comfortable and know what they need to know about administering the vaccines. Make sure they're updated on the proper injection technique, what needle size to use, and that all of those tools that you need are stocked. And if they know how to document properly the vaccine type, lot number, date, and the site of administration. Vaccine safety is also an important matter to consider when administering vaccines. The vaccine information statements are available online, the VIS. They're available on the CDC website and immunize.org. And they contain information produced by the CDC that explain both the benefits and risks of a vaccine to vaccine recipients. The federal law requires that the staff provide a VIS to a resident or their legal representative before each dose of certain vaccines. While most vaccines are, side effects are mild and temporary, serious side effects can occur. They are rare, but they can happen. And the VIS does have information about the vaccine adverse event reporting system that allows for ongoing safety monitoring. Next slide. So unfortunately, fall time, despite your best efforts with immunizing your staff and residents, you may still see some instances of these respiratory illnesses. Be sure to emphasize the importance of other preventative measures such as mask wearing, hand hygiene, social distancing, especially in the context of COVID-19, and also take a look at updating policies for outbreak response within your facility, including testing strategies. I had some slides, and I know we're coming up towards the end of our time here, but I did include some slides. Just going to skip through these on the core infection control principles from CMS. They are available on the CMS website. Won't have time to go through all of this, but just has some information on here about providing guidance for people entering your facility. Let's get to the next one. And also hand hygiene, face covering according to the CDC guidance, and instructional signage throughout the facility about proper visitor education on COVID-19 signs and symptoms and infection control precautions. Next slide. How to clean high frequency touched surfaces in the facility often, and the appropriate use of PPE by staff and effective cohorting. And all of this information will be available to you. Next slide. Touched a little bit on source control, face coverings. With the PPE ending, there were some updates on this, but for the overall guidance, the source control refers to the use of respirators and are still appropriate. Face masks and respirators, they're still appropriate in certain situations. Please skip to the next slide. It has the recommendations for source control. So it's recommended in facilities by people who are working or residing on a unit or area of the facility experience a COVID or other respiratory outbreak. Universal source control could be discontinued as a mitigation measure once the outbreak is over. And that's defined as no new cases of COVID infection in the past 14 days. Next slide. All right. Facilities are still required to report COVID-19 vaccination status through NHSN. Next slide. We are still required to provide education to residents and staff about the COVID-19 vaccinations and offer to get them vaccinated. Next slide. During the PHE, facilities were required to perform routine testing. That has been discontinued after the PHE, but there are still circumstances where testing is required, such as when people have symptoms. The next slide has a table with the testing trigger. So if someone's symptomatic, what the recommendations are. If someone has symptoms, they are required to be tested. If there's a newly identified case of COVID-19 and staff or resident that the facility has identified as a close contact, is test all staff, regardless of their vaccination status, that had a high risk exposure with a COVID-19 positive individual. And the same thing for residents, anyone who had that close contact. And if there was a newly identified COVID-19 positive staff or resident that is unable to identify close contacts, test all staff regardless of their vaccination status, facility-wide or at a group level if they're assigned to a specific location. And for residents, test the residents at the facility-wide level or group level if you can pinpoint it. But I always recommend, if you start to see cases pop up in an area where, you weren't expected it, they weren't directly impacted by the initial case, the facility may want to consider moving to a more broad-based testing strategy. Next slide. So any questions from anyone?
All right, so we do have a question that is in the chat already. And if anybody else has a question, please submit it using either the Q&A or the chat tools in your Zoom menu. And then you can also raise your hand if you'd like to request to be unmuted out and to ask your question out loud. So the question that's here already says, I am trying to find an updated EUA, that's emergency use authorization, I believe, for the COVID-19 vaccine on the FDA site, but I cannot find one. Where can I locate either a VIS or EUA?
Mm-hmm. Yeah, so this information is currently being updated. As I mentioned, the CDC has updated their site. I will inquire about the FDA site for the EUA, and I'll send that out with the information from this webinar.
Thank you. And everybody, I will email everyone later this week with the presentation slides and any other links, so I can include that link when I email you. I will be sending that to the email that everybody used to register today. Okay, so that's all the questions that we have so far. So I'm going to run over a couple closing items. So if anyone else has a question, please go ahead and submit them using the chat or the Q&A tool or raise your hand. I'd again like to invite everyone to next week's webinar, which will be about identifying changing conditions, and that will be the same time and place next Wednesday at 2 p.m. And we also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. Deborah Wright will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. And you can find the links to the live chats and all of our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. If you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org and I will add you to the list. And I will put my email and Jennifer's email in the chat shortly. And we just got another question. It says, can the flu and the RSV be given at the same time?
As far as, yes, as far as I'm aware, according to the RSV guidance, they can be given with other vaccinations. And I see another question. What is the criteria for being fully vaccinated? So for being considered fully vaccinated, this was updated yesterday. The recommendation for everyone 6 years and older is one updated COVID-19 vaccine. So everyone should get one updated Pfizer or Moderna vaccine, updated vaccine, regardless of whether they've received any original COVID-19 vaccines.
Thank you for your questions. And I'm going to toggle past our down to our contact slide, so that's on the screen. And I believe that's all the questions we have so far. I think we can go ahead and wrap up if you would like to, if you think it's a good time, Jennifer. Let's see, is that one's answered? Okay. All right. Well, that looks like that's it for questions. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It will be anonymous and will show as a pop-up as soon as the webinar ends. If you have a couple minutes to fill that out, we would appreciate it. Jennifer, thank you for joining us again today and for this great presentation. And we'd like to thank all of you for joining us again. And we hope to see you back here again next week.